P. Srinivasulu, Assistant Professor of Department of Oral and Maxillofacial Surgery, Adi Parashakti Dental College and Hospital, Melmarudu. In this video, I have made a small presentation on suturing techniques. Before going into the topic, I just want to mention one quotation. Practice makes man perfect. And the same practice makes man imperfect also. If you are practicing anything in a proper way, in a perfect way, definitely you will become perfect. Or else, if you are learning or practicing anything in a proper way or a wrong way, definitely you will become an imperfect. Not only a surgical procedures, whatever, anything you have to learn in a perfect way, then only you will become perfect. And coming to the suturing techniques is not only a surgical procedure, but also it is an art. So you have to improve your suturing skills and you have to practice your suturing techniques in a proper way. Then only you can give a best surgical results. You will become a good surgeon. Let's discuss about the topic suturing techniques. In this video, we will discuss about suturing, what are the goals of suturing and what are the different suture materials and what are the instruments used for suturing, how to hold the suturing instruments and what are the various principles of suturing and what are different types of knots, different types of suturing techniques and what are the alternative materials used for suturing and how to do suture removal. If the suturing is not proper, if the flaps are not adequately closed, it will lead to post-operative infection. So always suturing is very, very important for the success of surgery. If the flaps are closed properly, if the suturing is proper, definitely it will give you a good healing. Thereby, it will prevent the bleeding also. Next, what are the goals of suturing? Suturing is performed to permit a proper flap position and it provides adequate tension and it maintains hemostasis and it provides support for tissue margins and it reduces the post-operative pain and it prevents bone exposure. Always when you are doing suturing gives for the flaps in a proper approximated position. Thereby, what will happen? The tension will be distributed equally among the flaps. And if the suturing is a proper and the flaps are closed properly or adequately, it will prevent the bleeding. Thereby, it will reduces the post-operative pain. And what are the different types of suture materials? Suture materials are classified based on source, based on fate, based on structure, and based on coating. Based on source, again it is divided into natural, synthetic, and based on fate, again it is divided into absorbable and non-absorbable. And based on structure, again it is divided into monofilament and multifilament. And based on coating, again it is divided into coated and uncoated. And we'll see the various examples of suture materials. Natural absorbable. Natural absorbable are plain catgut and chromic catgut. Natural non-absorbable are silk, cotton, nylon, linen, and steel. And synthetic absorbable are polyclactin, polyglycolic acid, polydiaxonone, and polyglicarparol. And synthetic non-absorbable are polyamide, polyester, polypropylene, and polybutester. Among these, chromic catgut and linen and steel are monofilament. Plain catgut and silk are multifilament in nature. Whereas in synthetic, polydiaxonone, polyglicarpone, polybutester, and polypropylene are monofilament. Polyglactin, polyglycolic acid, and polyester are multifilament. And what are the various instruments used for suturing? The mainly instruments used for suturing are scissors, needle holder, needle, suture material, tissue holding forceps, and you can see various pictures of iris scissors, Olsen Hagar needle holder, and how to hold the instruments. Always needle holder, you have to use an appropriate size of needle holder for the size of the needle. And you have to hold the needle holder 1/4 to half distance from the swag area. Always you have to place the needle securely in the needle holder and should not overclose the needle holder whenever. Always needle holder you have to direct it by the surgeon's thumb. Should not use a digital pressure on tissues. It will lead to tearing of the flaps. And you can see the picture how to hold the instrument. Then coming to the principles of suturing. Needle grasped at 1/3 distance from the eye and 2/3 from the point. You can see in the picture, needle we have to grasp 1/3 distance from the eye and 2/3 distance from the point. So this is the way of grasping the needle holder. Then needle should enter perpendicular to the tissue surface. See, you have to see always this is the tissue line or incision line. You have to insert the needle perpendicular to the tissue surface and needle passed along its curve. How the needle curvature is, you have to pass the needle along its curvature and suture at an equal depth and distance from the incision on both the sides. Always, whenever you are doing a suturing, the distance and the depth should be equal from both the sides. The distance between the sutures will be the same. See, the distance between 1 and 2 and 1 and 3 should be equal, and the depth also should be equal on both the sides. And whenever you are doing suturing, always it has to come from movable tissue to the fixed tissue, and thinner to the thicker tissue, and deeper to the superficial tissue, and never ever close under the tension, because whenever you are doing suturing, if you close the flaps under the tension, it will give you most pain and causes of swelling and chances of flap tearing. So should not close the flaps under the tension always, and try to approximate, not to plunge. When you are doing suturing, you have to tie the flaps only for the approximation of the flaps, not to the plunge. And knot should not be placed on incision line. Whenever you are doing suturing, the knot should has to come away from the incision line. If it is come from the incision line or on the incision line, definitely the chances of loosening of the knot is more. So you have to give a knot always away from the incision line. Close deep wounds in a layers. Deep wounds are inner layers. You have to close by layering by layer. So first you have to close the inner layers and then you have to come to the superficial layer. So always deep wounds you have to close by layering by layer technique, and avoid retraining the needle by tip. Always whenever the needle was broken, should not retrieve the needle by holding the tip. Adequate tissue bite to prevent a tearing. Adequate tissue bite means whenever you are inserting the needle, you have to take an adequate thickness of the flap to prevent the tearing of the flap. In extraction wounds, sutures placed in interdental papilla, not in the middle of the sockets. Whenever you are doing suturing after extraction, extraction sockets always you have to insert the needle in interdental papilla, means you can have a thickness of the flap, more thickness of the flap in the interdental papilla region only. So you have to give a sutures in the interdental papillary region. Suture should be placed approximately 3 to 4 mm apart. Previously, we discussed always the distance between the sutures will be the same. So you have to maintain the distance minimum 3 to 4 millimeter from the suture to suture. If dog ear occurs at the end of incision, it should be eliminated. Dog ear, you can see in the picture, this is the dog ear. So whenever you close, if any dog ear like this, any approximation came like this, what you have to do, you have to extend the incision like this. You have to extend the incision like this and you have to close it properly. Dog ear should be eliminated. And then coming to the sutured knot. Sutured knot has three components. One is loop. You are doing suturing, no? So this is the loop and this is second part is knot and third one is the ears. The cutting edges of the sutures are called ears. And what are the various types of knots? There are three types of knots. One is surgeon's knot, another one is granite's knot, and another one is square knot. Square knot. Square knot is formed by wrapping the suture around the needle holder once in opposite direction between the ties. And in this, at least three ties are recommended. And best examples for square knot are gut, silk, and cotton. So square knot, what they are telling is always once in opposite direction between the ties. Means first knot you have to give in a clockwise direction, and the second knot you have to give in a anti-clockwise direction. If again you are going for a third one, you have to go in a clockwise direction. So once in opposite direction between the ties. And second one is surgeon's knot. Surgeon's knot is formed by two throws on the first tie and one throw in the opposite direction in the second tie. Two throws on the first tie, one throw in the second tie. See here you can see the surgeon's knot. First two throws and another one is one throw. Here you can see two throws in one first knot and two throws in second knot. Whatever first you are giving two throws or two throws in a clockwise direction, and second one you have to give in an anti-clockwise direction, whether it is a two throws or a single throw. And it is recommended for tying polyester suture material such as Vicryl and Maxillofacial. And third one is Grannis knot, a tie in one direction followed by a tie in the same direction and a third tie in the opposite direction to square the knot and hold it permanently. So first two ties you have to give in a clockwise direction and third tie in a opposite direction. So first tie and second tie in a clockwise direction and third tie in a anti-clockwise direction. And then coming to the main topic, different types of suturing techniques. What are the different types of suturing techniques? Simple interrupted suturing techniques, continuous suturing technique, continuous locking suturing technique, vertical mattress technique, horizontal mattress technique, and figure of eight. And the final one is subcuticular suturing technique. First one is simple interrupted suturing technique. The interrupted suture is the most commonly used and it is preferred in areas of tension over continuous sutures. Always simple interrupted suture gives a uh, nice closure for the flaps. If you are going for a closing the more length of incision, it will give more tension. So in the areas of tension over continuous sutures, in those type of conditions, you can use simple interrupted sutures. And the advantages is each suture is independent of the next. And the loosening of one suture will not cause loosening of others. See, in continuous sutures, the last one is loosened, the entire suturing will become loose. Whereas in simple interrupted sutures, if one suture will be loosened, the other ones will be tight. The other ones are not loosening. So that is the advantage of simple interrupted suturing technique. Then coming to the continuous suture. The continuous suture provides a rapid technique of closure and it provides even distribution of tension over the entire suture line. It provides a more watertight closure, which is especially important in intraoral bone grafting. It should not be used in areas of existing tension. So continuous sutures we should not use in tension areas. And the method of continuous suturing is first we have to give a simple interrupted sutures. How the simple interrupted sutures placed the same way. First we have to give a simple interrupted suture. Then we have to cut the short length of the end, and then the suture passes perpendicular to the incision line underneath the tissue, and it is ended by tying the last untightened loop of the sutures. So we'll see the video how to do a continuous suture in next slides. Then coming to the continuous locking suture. This technique offers two advantages over the simple continuous suturing technique. And the suture will align itself perpendicular to the incision. And also the locking feature may prevent adjustment of the tension over the suture line as tissue swelling occurs. So here you can see the continuous locking sutures perpendicular to the incision line. The suture is passed perpendicular to the incision line and degree of locking is provided by withdrawing the suture through its own loop. So whenever we are withdrawing the needle through its own loop, we are withdrawing the needle. The The suture technique is begun and ended identically like a continuous suturing technique. How in a simple continuous sutures will give a knot, the same way in continuous locking also, the unended part of the short suture will give a knot technique. And then coming to the horizontal mattress suture. Suture passes perpendicular to the incision line underneath the tissue and it is parallel to it on the surface and then again perpendicular to the incision line. So what they are telling in horizontal mattress sutures, first it will be a parallel to the incision line and then perpendicular to the incision line. So a continuous horizontal mattress suture is often used after intraoral bone grafting as the aversion and continuity provide a very watertight closure. Instead of continuous locking suture, horizontal mattress sutures is given more watertight closure. And then coming to a vertical mattress sutures, needle is passed close to the incision line on both the sides. First, we have to insert the needle close to the incision lines. First, we have to insert from here close to the flap, and then again we have to insert the needle close to the flap. So, needle is passed close to the incision line on both the sides, and then engages each tissue to the first pass. When returning towards the original side, we have to give a knot. Then coming to the figure of 8. The figure of 8 suture is used to over extraction sites. Always in single extraction sites, at single extraction sites only will use a figure of 8 closure because it will give a proper protection to the socket as well as adaptation of the interdental papilla around the adjacent teeth. Then coming to the subcuticular sutures. Subcuticular sutures always will give on a skin layers. A continuous subcuticular suture can be used with the no knots by having the ends exist a short distance from the wound and tapping to the skin. So always in subcuticular sutures at the ends, you should not give any knots. In this technique, non-absorbable sutures are ideally used. Free passage of the suture along the incision to facilitate subsequent removal is ensured by pulling the ends after placement. So always after the healing procedure, any end by this side or this side, you have to hold the end and we have to pull to remove the entire suture. A continuous subcuticular sutures may be left for 7 to 10 days and it is removed by pulling in one direction. And in this video, we will discuss about simple interrupted, vertical mattress and horizontal mattress sutures. How we will do a simple interrupted sutures, horizontal mattress sutures and vertical mattress sutures we'll see in this video. Simple interrupted, vertical mattress and horizontal mattress suture techniques we'll see in this video. So before going into the suturing, how to prepare, we have to wear the gloves properly. And these are the various instruments used for suturing techniques. Needle holder, and then add some tissue forceps, and then suturing material, and the scissors. So these are the various instruments used for suturing technique. First, we'll see the simple interrupted suturing techniques. See in this video, the first one is a simple interrupted suturing techniques, and the second one is vertical mattress suturing technique, and third one is a horizontal mattress suturing technique. And we'll see how to do these suturing techniques. So first we have to insert the needle from here. So this is the entry point of the needle for simple interrupted suturing technique. So again we have to take the needle exit point from here. So again we have to hold the flap and remove the needle from the opposite direction. Now we are giving a type to the simple interrupted suturing technique. This is an instrument type. And mainly don't confuse with the knots, because previously I told that 2 knots or 3 knots we have to give, but in this video they'll give a more knots also. Always the knot technique is depends on the surgeon. How much tight closure we need, it depends on those. So always the knot technique is decided by the surgeon. Then we'll discuss about the vertical mattress sutures. So already we discussed vertical matters. First, we have to insert the needle close to the incision line. Then we have to insert the needle away from the incision line. So first, the entry point of the vertical mattress is close to the incision line point. We have to insert the needle. So in this video, first they inserted the needle away from the incision line. Then again they are taking from the close to the incision line. So first entry point away from the incision line, and next entry point close to the incision line. Again lift the flap and take out the needle from other side close to the incision line. So remove the needle by holding with the adhesives tissue holding forceps. Go to give a knot. Knot technique is same how we given in a simple interrupted suturing technique. We can give an instrument type. So always knot should not come on the incision line. Always knot has to come away from the incision line, as we discussed in principles of suturing. So this is the technique of vertical mattress suturing technique. So not given, and then we'll see how the horizontal mattress suturing technique will be. Horizontal mattress sutures. And horizontal mattress sutures we discussed already. It will give more watertight closure, and horizontal mattress sutures it will be parallel to the incision line and perpendicular to the incision line, and it will come as a square shape. See, you can see it will come as a square shape. So this is the incision line. So first it will come around perpendicular to the incision line. So entry point, and then next entry point. So it is coming as a perpendicular to the incision line. Now it is coming as a parallel to the incision line. Okay, inserted from the same side. So this is perpendicular direction and this is parallel direction. So again reload from other side. Remove the needle by holding with the adhesive tissue holding forceps. And then finally we're going to give a knot. So the knot technique is same. You can see the square. So this is a parallel, sorry, this is perpendicular and this is parallel. So the perpendicular suture will come underneath the tissue. You can see only the parallel sutures above the skin surface. So we see the simple interrupted sutures and vertical mattress suture and horizontal mattress suture techniques in this video. Then We will discuss about simple continuous suturing technique in this video. How we will do a simple continuous suturing techniques. Simple continuous suturing techniques, already we discussed the disadvantage of simple continuous suturing technique is if the end suture was loosened, the entire suturing will become loosened. So whereas any tension will be there under the tissues, we should not use this simple continuous suturing technique. So how to do a simple continuous suturing technique, we'll see in this video. So in simple continuous suturing or a simple continuous locking sutures, first we have to place a simple interrupted suturing technique. First we have to insert the needle one side of the flap. So this is the entry of the needle on one side, and again we have to remove the needle from the other side of the flap. So remove the needle and give a knot like a simple interrupted suture. Like simple interrupted, not see not came away from the incision line. See, they're wrapping the suture material around the needle holder. That is called a throw. So two throws in one direction and two throws in another direction. See, they are giving a 4-5 knots. I told you already. The knots given by how many knots we have to give, that is depends on the surgeons. So depends on the how much tight closure we need. Then after given a simple interrupted sutures, the short end was we have to cut the short end of the suture and we have to continue the long edge of the sutures. Now we have to continue the suturing technique without cutting the longer edge. Again, we have to insert the needle from the same point. Insert the needle. And again, we have to take out the needle diagonally. How they are inserting the needle from this direction to that direction, diagonally they inserted direction. Again, it is coming perpendicular to the incision line. See how much tight closure it is given. Again, load the needle and lift the flap and we have to insert the needle. So like this, we have to continuous 3, 4 or 5, depends on the incision length. We have to continuous like this. Again, we have to load the needle and we have to insert diagonally. So pull it tightly. How to give a knot, you can see. So without pulling the suture material completely, we have to maintain some short end of the previous suture materials, and again we have to wrap around the needle holder, hold the previous suture one, and then give a knot. So this is a simple continuous suturing technique. In continuous suturing technique, the difference between a continuous locking and continuous suturing is only thing when you are going for next suture, we have to insert the needle in the previous loop and you have to lock the suture. That is the continuous locking suture. And these are the various alternative materials used for suturing. skin staples, surgical tape, and the cyanoacrylate glue. Cyanoacrylate glue. So these are the materials used for closing the flaps, alternative of suturing materials. And then coming to a suture removal. Intraorally suture removal done in 7 days. In case of tension, we have to keep it for a 10 days. On suture area, before going for suture removal, first we have to clean with a chlorhexidine solution or a betadine solution. And then the suture is grasped with an anatomic forceps or a tissue holding forceps or a tweezer and lifted above the epithelial surface. Then scissors passed underneath the tissue, underneath the suture material, and we have to cut the suture materials. Then the suture pulled out towards the incision line. If the suture is entrapped in the scalp, application of hydrogen peroxide and sodium chloride is necessary to remove the suture materials. If any piece of suture material is left inside the incision, it will give a granulation, granuloma formation or an infection. So this is the way of suture removal. So first we have to pull the suture and then we have to cut the suture material close to the knot and then we have to pull in this direction to prevent the entrapment of the knot in the incision. Thank you. Have a nice day.